I am Keira Sorrells, the Executive Director of the NICU Parent Network, and I am very happy to be here today with Jennifer Canvasser from the NEC Society. Today we are doing one of our health highlights where we focus on a particular disease or um, medical complication or issue that arises with a lot of NICU babies. And today that is NEC or necrotizing enterocolitis. So Jennifer, thank you so much for being with us.
Thank you.
So let's just jump right in and tell me how you were activated to do your work related to NEC.
Yeah, for sure. So my twins were born at 27 weeks gestation. And when they were about 6 weeks old, they had been doing really well. But suddenly my son Micah developed necrotizing enterocolitis and he became critically ill, very sick, had a lot of complications from the disease. But he came home and we thought he had overcome his most difficult obstacles. And then tragically, about a month after he was at home, he was readmitted to the PICU because he had developed pneumonia. And then he passed away from complications of NEC just before the twins' first birthday. And so I went through just like the first year without Micah in my arms of just like grieving and learning how to like how do I eat, how do I sleep, how do I just function without my son physically in my arms. And then I looked around, and about a year after he passed, I was looking for an organization that I could volunteer, maybe donate a little bit of money and just help, get involved with whatever organization was working on necrotizing enterocolitis. And at the time there was not another organization in the world that was focused on necrotizing enterocolitis. And so I feel very lucky to have a background in community organizing. I have a master's in social work. I've done nonprofit leadership for many, many years. And so I had kind of the infrastructure in place and the knowledge of how to, form an organization. And so I was really lucky to be able to build the NEC Society in honor of Micah, but really because I knew that my story is not unique, that families continue to be devastated by this disease.
And let's talk about the disease because we still, despite research efforts, there's still a lot of unanswered questions and there is no cure. So let's just do a bit of a high level. What is
Mhm.
NEC? If someone hasn't heard of it or think they've kind of heard of it, tell us about that.
Yeah. So necrotizing enterocolitis is an inflammatory condition that affects the gut of neonates. So it typically affects babies in their first weeks and months of life, typically those babies that have been born prematurely or who have some other medical complication. And we don't really understand fully why it happens, which is incredibly frustrating because if we don't know how it happens or why it happens, we don't know which babies are going to develop the disease and when and how to intervene or how to treat it. Like you said, it's we can't cure it. Once NEC starts, it tends to be devastating. It progresses very rapidly, and some babies die within like hours or days after just their diagnosis. And so that means a lot of families, including myself, learn about NEC for the first time when their baby is actually being diagnosed.
Mm-hmm. Yeah. And it's not just premature babies though. This can happen
No.
in later because when I, first kind of got into this world, I thought it was just a micro preemie thing,
Right.
but that is not the case.
No, not at all. I mean, and I've learned a lot from the other families that have since gotten involved in the NEC Society and have shared their story. But Micah's case is, an example. He was 33 weeks gestation, corrected by the time he developed NEC. So yes, he was born at 27 weeks, but he didn't develop NEC until he was well over 6 weeks old. And he weighed 5 pounds. He was on a nasal cannula, like very stable, doing great. And then out of nowhere, he developed NEC. And that is often the story where these babies are doing well. And like you just mentioned, sometimes the babies are born at term. And some of the babies, they go home and then they come back and they come back to the hospital because they are sick and they're diagnosed with NEC. It typically happens again in babies that have an underlying health condition. So for example, if the baby has a cardiac defect, so something is wrong with their heart, they're at a much higher risk for necrotizing enterocolitis, even if they're born at term.
Okay. And I've heard there's surgical NEC. So is that basically the only treatment is to remove that part of the intestines?
Yeah, thank you for asking. So it depends on how advanced the disease is by the time the clinicians realize what's happening and how quickly they can intervene and how responsive the baby's system is to, say, antibiotics. So antibiotics are typically started. Again, I'm not a NICU
Right.
a
Yeah.
healthcare provider, so I don't want to say
Right. Yeah.
I'm a NICU parent, but
Absolutely.
typically antibiotics are started, and if the baby is still not doing well, then they're typically taken into for exploratory laparotomy, for example. That's what happened with Micah. And then if it's found that they have pieces of their bowel that is dead or diseased, that piece of the bowel is removed, because otherwise it will just keep spreading and the whole gut could potentially die. And that's obviously very devastating. So a lot of these kids end up with short bowel syndrome. Again, what happened with Micah also, and a lot of other complications. So it tends to so it's devastating outcomes in terms of morbidity and mortality. So the babies who do survive still tend to have some significant lifelong complications from the disease.
Yeah, and that was actually my next question was, a lot of times we think, okay, they have the surgery and then they're fine and go on to live, and that certainly is the case for some children, but for
Yeah,
others, they do end up with lifelong
for
medical
sure.
complications because of it. Um,
Absolutely.
so how, when you developed NEC Society, what was your goal in doing that? What did you want to
Yeah.
accomplish? And I love, up in the corner of your screen, building a world
Yeah.
without tech. I mean, that says it all, but I want to hear from you.
For sure. So that is our vision. Our goal is to put ourselves out of business and shut down the NEC Society. Like, we don't want to be here. I actually was an environmental activist before the NEC Society. So I'd love to go back to protecting the environment instead of having to protect preemies from NEC. So please, like, shut down the NEC Society. I would love to not be needed here, but I'm really, because I know that I am needed and the organization is needed, I'm really compelled to do this work. And so the vision of the NEC Society is to build a world without NEC by bringing together diverse stakeholders. So we bring together patient families who've been personally affected by the disease, the clinicians who have dedicated their careers to caring for these babies. They care so deeply. I'm always inspired by the clinicians that we have involved in the NEC Society, who are they're so authentic and they're so caring, and they really go out of their way to better understand and provide better care for families and babies like mine. So to bring together the patient families, the clinicians, the researchers, and then just any other stakeholders who care about infants and are concerned to advance. Our kind of goal is to advance NEC research, so better understanding and how to prevent the disease, better treat the disease once it happens. So NEC research, education, so making sure that families and clinicians are well informed about best practices, the protective and the risk factors that are associated with NEC, and then also advocacy. So making sure that, for example, all babies in the NICU have equitable access to pasteurized donor human milk if it's needed. If their mother's own milk is not available, then they should all have access to pasteurized donor human milk. And currently that's not the case. It's not universally available to all babies in the NICU. And we think that's unacceptable. So we're constantly advocating for that and working hard to advocate for babies and families.
And I think one of the most beautiful things about what you have done with the NEC Society is how fully integrated patient families are at every level. It's not just, having families up on the stage to tell a sad story. You really have integrated. Can you talk a little bit about that? Because I think sometimes families might wonder, well, how can I make a difference really?
For sure.
But
Yes.
really, really actively, wonderfully involved families for a long time.
Thank you so much. Yeah, we work really hard to ensure that our patient families work hand in hand or direct partners with the clinicians and the researchers on our team. And they're playing on an equal level. So it's not like the clinicians are up here and the families are down below. Like they are colleagues in this work to build a world without NEC. And so some of the projects that we've done together include the NEC Symposium. So we host medical conferences, and those are planned in collaboration with patient families and our clinician researchers. Together, we build the agenda. We invite the speakers. The whole conference is planned together. We also put out a lot of educational materials. We actually soon will be releasing and launching our probiotic toolkit. And again, the whole toolkit was built in partnership with our patient families and our clinician researchers. And it's for NICUs who are trying to decide, like, should we use probiotics? How do we use probiotics? And have questions about the process. And it's not necessarily to guide NICUs one way or the other, but it's to emphasize the importance of communication with their inpatient families and making sure that families understand and really feel invested and can buy into the rationale between of like, yes, we're using probiotics, or no, we're not using probiotics, and this is why. So that's a couple of examples. We've also done research, of course, in collaboration with families who have been authors on the papers. We released our prioritized research agenda. That was a very elaborate process to build a prioritize, like so basically we said, like, what are the top priorities in the field of necrotizing colitis? There's so many things that we don't know. There's so many things that are misunderstood, that are not understood. How do we prioritize our very limited resources and capacity to ensure that we are directing what we have towards the problems that that are most urgent and impactful? So that's what we built together as in terms of our prioritized research agenda. And I can go on and on and on.
I know.
I'll stop. And you get it. You kind of get the feeling for what we've been
Yes.
able to do by bringing together families and clinicians.
Yes, absolutely. And that's just, it's so critically important that parents or families are included at every level from the beginning, not just at the end.
Sure.
That's how we know that we're actually working towards things and outcomes that are meaningful to the families. So let's talk a little bit about May, which is Necrotizing Enterocolitis Awareness Month. Tell me how and when you got that started, and then we'll talk about how people can get involved and celebrate and draw that greater awareness.
Thank you. I have to give full credit to the NEC patient family community for NEC Awareness Month and NEC Day, because to be honest, I'm like, why do we need a month? Why do we need a day? Like, I do this work all the time. It's always NEC Awareness Month. And so I honestly was I'm embarrassed to say that, but I was like, I didn't fully recognize the value at first, but our community, thank you community, kept pushing us like, no, we need a dedicated month, we need a dedicated day. Yeah. And they were absolutely right. So I thank them, our community, for their leadership and for being vocal and expressing and helping to really, and that's what I think makes the NEC Society so unique, is we are very responsive to our community and what they are asking for, what they're telling us. We've changed, to be honest with you, what the tagline for the NEC Society, it was not always building a world without NEC. It was protecting preemies from NEC, what used to be our tagline. And our community was like, there are term babies affected by NEC. We don't see ourselves reflected in your tagline. I've said, you know what, you're absolutely right. We are changing our tagline. And so just an example of how we are very responsive to our community. So anyways, in 2018, we established, after our community's encouragement, established May as NEC Awareness Month and May 17th as NEC Awareness Day. We got together with other colleagues that are working on NEC around the world, including in the United Kingdom, Australia, Brazil, and of course in the US. And we got together and said, yep, May is a good month. This is why. And we're doing May 17th as NEC Awareness Day. And actually in California, I'm hoping, I have a state legislator who plans to introduce a resolution to declare May 17th as NEC Awareness Day in California. We're hoping to replicate that in other states. So lots of awareness happening and going on.
Yeah. So if people want to get involved or celebrate, how can they do that? I know, sure, you have things on your website.
Yeah, so my colleague Erin Umberger does amazing graphic designing. So we have some really great graphics that we encourage and ask you to please use and share. Help us really elevate the conversation around this devastating disease that more families need to understand and be aware of. And so, yes, if they visit necsociety.org, you can check out the graphics that we have for you to share. There's also a lot of different ways that families and anyone that cares can get involved. They can organize walks in their community. They can write to their legislator. They can start a fundraising page. Lots of ways to honor their child if they've been affected by NEC, or otherwise contribute and support the NEC Society's effort to build a world without this devastating disease.
That is fantastic. And tell us your website. And of course, we'll post all the links and everything when we post the video.
Thank you. Yeah, you can join us at necsociety.org.
Perfect. And just lastly, as we close, what is one thing that you wish parents knew, parents who are affected by this disease?
I really wish that families knew the protective and the risk factors. And you said what I wish they would have, knew before maybe they were diagnosed, is really what I'm getting at. Is I think that if families were able to have the information they needed to advocate for their child, that I think we really could make a dent in reducing the outcomes and the devastation of this disease. So I just wish that all families had the access to the information about the risk and the protective factors.
Wonderful. Well, Jen, thank you so much for sharing a bit about the work that you do, which is really just amazing. I've had the privilege of being able to watch you kind of get started and grow these last several years. So thank you so much for doing the work. I hope that we won't need you forever, just like you said.
Me too. Me too. Then I can join you and
Yes,
help other like broader NICU families.
there you go. Sounds good to me. Well, thank
Thanks,
you so
Keira.
much. And everybody, please take a look at the NEC Society's website and learn how you can celebrate, draw greater awareness, make sure that you're tagging NEC Society in anything that they do, and reach out because they are always, always including families in so many different ways. So thank you so much, Jen, and we will talk to you again soon.
Thanks so much.